Hello, I'm Dr. Silvio Nak. Today I want to talk to you about a new technique that is not that new, it's quite old, but it's new in the area of medical procedures. It's been almost 15 years now since this was first used in Sydney, Australia, as a technique for treating a lot of different diseases. Basically, it's been used for treating inflammatory bowel diseases, one called Clostridium difficile, produced by a bacteria that's normally in the gut, that because of the usage of antibiotics, this bacteria, this microorganisms, tends to increase its number and aggressiveness and produces something called pseudomembranous colitis that can put in danger the life of the patient. So what we've been using is the fecal bacteria of a normal guy, a normal donor, into the gut that is diseased, that is sick. This is sounds like a crazy thing to do, but it's been in use for many years and it's a very safe technique and has incredible results. We've seen kind of magical recoveries from patients that were very sick, mainly inflammatory bowel diseases like ulcerative colitis and Crohn's disease, which is the biggest experience right now. But not only there, but in obese patients, in diabetes type 2, there are many protocols now in place in France, in Switzerland, in the Netherlands that are treating patients with this technique, and not only for gut disease, as I said. So basically what we do is we obtain the fecal matter from a donor and we take great care that this is preserved, because these bacteria are very sensitive to light and oxygen, and we process them very cautiously and very fast. We don't let this precious material into an open air for a long time, because it deteriorates very easily. So the lifespan of this is less than 4 hours. I would say that within the first hour we get the best results. What do we know today? We know that if we use this material and we put it into a gut, we can change a lot of the different processes that take place in this person. We can change inflammation of the liver, for example. We can change inflammation of joints. We can treat a lot of neurological problems. But this is all in study right now. What we certainly know is that we can change the course of the inflammatory bowel diseases. How do we do it? We take this fecal product and we insert it into the gut of a diseased person. You could use the oral way, which is quite a technique and should be done in a hospital environment, or you can do the anal way through a thin cannula, and probably that's where we obtain more good results than any other technique. Risks. If the donor is thoroughly studied, we can be sure that there are not going to be any problems. Any transmittable disease should be outruled. So that's where we put our maximum attention to avoid any transmittable diseases into the receptor. the benefits of these techniques are almost immediate, but we know that we have to keep doing it because the inflammation, the inflammatory diseases are something that's been in the system for a long time. The person that is inflamed just see the benefits very fast, but just to keep them going, to keep the benefits, the technique should be repeated and repeated on a regular base. Not just one set of implants is going to maintain the benefits. We have to keep on doing it for a prolonged time.